Dr. Sventovani figured out, probably, actually it's 20 years ago now, is that people with asthma seem to have less active beta, what are called beta receptors, which is, so here you take, they have fewer of them and they're less active. If everybody here knows about asthma, which I assume you all do, many of you know about the medication Ventolin, Proventil, albuterol. Well, that's stimulating your beta receptors. So if you go on a beta blocker, you've just blocked the medication that would work. At the same time, you have fewer receptors for the medication to work. So that's a factor that you should avoid, a beta blocker, even in an eye drop. Sulfite-containing foods. There's a subset of asthmatics. I've always explained it that roughly out of all the asthmatics, maybe 10% are allergic or sensitive to aspirin. And of that group, there's a subgroup of that group that's sensitive to sulfites. Don't know how many of you all drink wine, but I'm sure you've seen wine naturally has sulfites. They're not really adding it to them. That's just, you ferment it, it develops sulfites. What the U.S. government's required at this point in time is to label it, hey, there's sulfites in here. Years ago, I saw a case, I'm trying to remember why it was for legal reasons. Essentially, the lady died at the case is settled, so I can speak about it, at the Galleria Mall in Fort Lauderdale. She went to the salad bar, I won't mention the restaurant, ate the salad, went into a severe asthma attack, and proceeded to arrest and die right there in the mall. The lawsuit, and that's how I was involved, was against the restaurant. I don't know how they did this, but they found a bottle of sulfite in the preparation zone of the salads, and at that point in time it was illegal to use sulfite on the salads. They not only were suing the restaurant that she ate the salad and died at, but they sued the restaurant she'd had a reaction at the week before, where she ended up in the Holy Cross Hospital emergency room after she ate at the salad bar. And it was my job I think I was hired by the restaurant, one of the restaurants. The lady had a history of aspirin sensitivity, so she knew whenever she took aspirin or ibuprofen, she developed a severe asthma attack. And she knew there was something in the salad bar that gave her asthma. And if you read the deposition of her surviving daughter, they would say, well, Mom was always careful in the salad bar. But to this day, I'm not sure what she was careful about, and she probably wasn't that careful. But that's something you have to be aware of. If you're aspirin sensitive, you may be sensitive to sulfites. And I have a list that I give out to all patients that lists foods that have sulfites. Oops, now how do I get it back? Okay. Aspirin I just mentioned. Acid reflux or gastroesophageal reflux disease is a factor that contributes to the severity of asthma. If you're having heartburn, you're aware of it. But guess what? It could be silent. So then you wouldn't be aware of it. So if Dr. Jacobson or I see patients whose asthma is difficult to control, one of the things we'll do is try to assess if GERD or acid reflux is present. And certainly an influenza vaccine will help prevent one of the respiratory infections that trigger asthma. Now we'll get into the house dust mites. These are the recommendations to reduce house dust mites. And I'll just very quickly, I'm looking at the time, tell you the story of why when I finished my fellowship...
It is a 2-hour lecture, right?
It is, okay.